So what is the swelling in your breast or your chest after your breast surgery? What causes it? How do you get rid of it? And when does it become an emergency situation? My name is Kelly and I'm a physical therapist and I specialize in oncology, lymphedema, and women's health. And in this video, I'm going to go through the 4 causes of breast swelling after surgery and what you can do to get rid of it. So follow along. First, it may just be surgical swelling. If you're less than 6 weeks out from your surgery, you are likely still going through the healing process. It's not uncommon to have swelling for up to 6 weeks, and for some, even up to 12 weeks. Like with any major surgery, your body has to go through a normal healing process. So swelling is going to be a component of that. In order to keep the swelling at bay and help get the fluid moving out quicker, you can try a couple things. You can try icing or gentle compression if clear to do so. You also want to avoid repetitive motions. It's good to move, it's good to use your arms gently, but you don't want to lift a lot of heavy things or jump right back into any high impact exercise. If you have any movement or lifting restrictions, work with your surgeon to know when you are cleared to get back into your exercises. Second, the swelling may be a seroma. A seroma is a pocket of fluid that sits right under the skin in an open space after surgery. They will feel soft and they may move like a water balloon would. They are relatively harmless, but we do want to get rid of them because over time, if we let them go, they tend to harden. If it is small, they tend to reabsorb on their own. You may also try some gentle compression if your surgeon allows it. However, if the seroma is larger, your doctor or surgeon may want to aspirate or drain it. The seromas can return after you drain them, however, they do tend to go away as you heal. Most commonly, seromas will show up in the first 1 to 2 weeks after surgery. To avoid a seroma from forming, you want to try to avoid a lot of overhead activity or a lot of repetitive exercise after your surgery. Limit your activity and your movement for the first couple weeks, and sometimes very gentle compression after surgery may help avoid one from forming. The third cause for swelling may be lymphedema. Lymphedema is a backup or dysfunction of the lymphatic system. It is most common for women who've had lymph nodes removed during their surgery for breast cancer. The more lymph nodes you've had removed, the higher your risk may be. Radiation can also attribute to lymphedema. Radiation can cause fibrosis to the area, which is kind of like scar tissue or thickening of the area, and that can block the pathways of the lymphatic system, causing a backup in the chest wall or breast. If you catch lymphedema early, you may be able to reverse it or slow its progression. I do have a video about reducing your risk of getting lymphedema after surgery, and I will link that below. Unfortunately, there is no true cure for lymphedema. However, there are things you can do to keep the swelling down at bay. Compression, lymphatic massage, also known as manual lymph drainage, and exercise are the major components to help manage lymphedema. For exercise, your muscles act as a pump to your system. So when you're moving or activating or contracting your muscle, you are going to squeeze into that area, which will help get the fluid moving. Be sure to watch out for my next video for breast and chest lymphedema exercises for a full routine by subscribing to my channel. Manual lymph drainage or a lymphatic massage is a very gentle technique to help get the fluid assisted moving out of the area. There is a sequence and a technique behind it, and I have made a video on manual lymph drainage that you can do for yourself at home, and I'll put the link for that video below. The last and most important part to help get the swelling down or lymphedema down in the breast area is compression. You can try a compression bra, compression tank top. You want to make sure that you find one that is full coverage. Some people will try something like a sports bra that's pretty general. That is a little bit of a lighter option that some could try if they have a really mild lymphedema. However, you want to make sure that it comes all the way up on the sides and is full coverage across the front. That will give you maximum results so you don't get new pockets of swelling on the areas that are not compressed. If you have a really stubborn area, like right on the breast or on the side of the chest, you can try something like a swell spot, which comes in different sizes and shapes that fit and form around that area that you can put inside your bra, inside your tank top, to give a little bit of extra compression throughout the day or the night. I will put a link below on where you can find or purchase a swell spot. I also made a video on how you can make your own from home, and I'll also link that below. The last thing you want to watch for when you see swelling of your breast after surgery is infection. It's extremely important to follow up with your doctor or your surgeon immediately. So what do you look for and what is an infection? If the swelling comes on really quickly, if it's red, if it's hot, if it's tender to touch, those are all things that you do want to go in and get looked at. If you don't have access to your surgeon or your doctor right away, I would recommend going to the emergency room or urgent care. So those are the 4 main causes of swelling after breast surgery. If you have any other symptoms that we did not talk about, make sure that you talk to your surgeon or your doctor. It's important to follow up with your medical team for more personalized treatment, as this video is meant for general education only. Please subscribe and hit the like button if you found this video helpful, and we'll talk to you soon. Thanks everyone.